Hello everyone, this is Ola. In this second video about the neurophysiology, we will discuss the types of receptors. We will focus though on the first type, which is the adrenergic receptors. So there are two types of receptors that we will focus at responding to different neurotransmitters. Adrenergic receptors, so they are adrenergic. They respond to adrenaline and noradrenaline neurotransmitters that we call also catecholamines. And adrenaline is known as epinephrine, noradrenaline is known as norepinephrine. The other type of receptors are the cholinergic ones, and they respond to acetylcholine neurotransmitter. Let's begin with the adrenergic receptors. They are active during stress. They work with the sympathetic nervous system. The adrenergic receptors are classified into alpha adrenergic receptors and beta adrenergic receptors. Each one is classified into 1 and 2. So there are alpha 1 and alpha 2 adrenergic receptors, beta 1 and beta 2 adrenergic receptors. We will focus here on the alpha 1 receptors. They are found in our blood vessels. So during stress, the alpha 1 receptors in the blood vessels are stimulated by norepinephrine. And what happens is vasoconstriction of the blood vessels. So the blood vessels will be narrow in diameter. This leads to increased blood pressure. So vasoconstriction leads to hypertension. Vasoconstriction, hypertension. Also, they are found in the iris around the pupil of the eye, and when they are stimulated, pupillary dilation happen. So you expect to see a dilated pupil in an angry person because of the stimulation of the alpha-1 receptors in the iris by norepinephrine. The beta-adrenergic receptors are beta-1 and beta-2. Beta-1 receptors are found in the heart. And when they are stimulated by epi or norepi, the heart rate increases as well as the force of heart contraction. So more blood will be pumped from the heart. Beta-2 receptors are found in the bronchioles, and when they are stimulated, bronchodilation happen. Remember, the adrenergic receptors are the ones stimulated by the sympathetic nervous system. So during a stressful situation, or if you are doing physical exercise, you need more oxygen to be inhaled. So here, beta 2 receptors will be stimulated and more air, meaning more oxygen, is going to be inhaled. Also, the beta 2 receptors are found in the blood vessels supplying our skeletal muscles. So, alpha 1 receptors are found in the blood vessels everywhere in the body. There are more alpha 1 receptors in the blood vessels than beta 2. Beta 2 receptors are found in the blood vessels supplying our skeletal muscles. So when you are doing physical exercise, those beta 2 receptors will be stimulated. Vasodilation happens in the blood vessels supplying your active skeletal muscles, so more oxygen is going to be supplied to them. So here, alpha-1 receptors are found in the blood vessels. When stimulated, vasoconstriction happens and the blood pressure increases. They are found in the iris. When stimulated, mydriasis or pupillary dilation happen. And they are found also in the internal urethral sphincter of the urinary bladder. So they close this, preventing urination. So again, our blood vessels have alpha-1 receptors all over the body, but the blood vessels of our skeletal muscles, in addition to having alpha 1, they also have beta 2. So when you are doing physical exercise, now she's doing physical exercise, moving her arms. So the arms, they have now active muscles, working muscles. So what will happen here is that the beta 2 adrenergic receptors will be activated. So more blood goes to her active muscles. How about the blood vessels in the viscera, in the internal organs, or in the non-active muscles? Now, the alpha 1 are the dominant ones, and they will be active. So beta 2 are stimulated when you need to. So if you move a group of muscles, those muscles need more oxygen. So beta 2 are stimulated, vasodilation of those specific blood vessels happen, more blood goes to your active muscles. So what would you do if you want to activate beta 2 receptors in your muscles, blood vessels, and you want to do general vasodilation? What type of exercise would you do? You want to do a type of exercise that makes your muscles active all over the body, like aerobic exercise, running, swimming. All of these muscles work almost every muscle in the body. So beta 2 receptors are going to be stimulated in them, and this leads to vasodilation. So why doing physical exercise is so important in hypertensive patients? Because when they do aerobic exercise, their beta 2 receptors are stimulated and vasodilation happens in them. Vasodilation means the blood pressure goes down. So sometimes even early stages of hypertension is only treated with diet and exercise. It's sometimes enough to treat mild hypertension. Beta 1 receptors are here in the heart. When stimulated, the heart rate increases. We call that chronotropic effect. And the force of contraction also increases, and we call that inotropic effect. So stimulation of beta 1 receptors in the heart will stimulate both inotropic and chronotropic effects. Heart rate increases, force of contraction also increases. They are found also in the kidney, but we will study that later when we do the renal system and the blood pressure. So in case of decreased blood pressure, beta 2 beta 1 receptors in the kidney are stimulated. They will release something that we call renin, and this helps to get your blood pressure up to the normal direction. It's a negative feedback. Beta 2 receptors are found in the lungs, in the blood vessels of the skeletal muscles, and they are working with the sympathetic nervous system everywhere in the body. For example, during stressful situation, or if you are doing physical exercise, you do not digest food at this time. So here, beta 2 receptors in your digestive system, when they are stimulated, they will stop the movement, motility of the digestive canal, and they will decrease digestion as well. Now, let's think here. How does a medication that antagonize beta 2 receptors in general, like it's to block beta 1 and beta 2, affect the heart, and how does it affect your bronchioles? So if you block a type of receptor, the opposite effect to their stimulation happens. So when you block beta 1 in the heart, what will happen is decreasing heart rate and force of contraction. And beta 2 in the lungs, when they are stimulated, bronchodilation happens. But if you block them, the opposite happens. So what would happen here is bronchoconstriction. So less air will be inhaled. So at the level of the heart, when you block beta 1 receptors, the heart rate decreases and the force of contraction decreases. So you can use beta 1 blocker to treat arrhythmia. And at the level of the bronchioles, if you block beta 2, bronchoconstriction happen. So in treating arrhythmia, which is a type of irregular heart rate or very rapid heart rate, physicians choose to do a selective beta 1 blocker. They don't want to play with beta 2. They don't want to block beta 2. Why is that? Because if you give a general beta blocker, yes, you will treat the heart and decrease the heart rate by blocking beta 1. But on the other hand, when you block beta 2, bronchoconstriction happens. This would lead to asthma. Less air can be inhaled here. And this is a serious problem. So here, to avoid inducing bronchoconstriction, to treat arrhythmia, you need only to block the beta 1 receptors in the heart. Patients with bronchial asthma, so they already have severe bronchoconstriction in case of bronchial asthma. What would you prescribe to them? Beta 1 agonist, beta 2 antagonist, beta 2 agonist, or beta 2 antagonist. You want to do bronchodilation, right? So when you stimulate the beta 2 receptors by giving a beta 2 agonist, what will happen here is bronchodilation to treat that bronchial asthma. Okay, now let's go with some review questions. What effect does beta 1 agonist produce? Agonist means something that does the same effect like the neurotransmitters in the receptors. So it's going to stimulate the receptors. So when you stimulate beta 1, what happens at the level of the heart? Here, the heart rate increases and force of contraction increases. How about if you stimulate the beta 2 receptors in the lung? What will happen here is bronchodilation. So beta 2 agonists are found in the inhalers used to treat bronchial asthma. What effect does beta 1 antagonist or blocker? Antagonist or blocker is the medication that prevents the receptors. So if you block beta 1 in the heart, what will happen is the opposite of their stimulation. So the heart rate decreases as well as the force of contraction. How about beta 2 antagonists? What is their effects on the lungs? If you block beta 2 in the lungs, what will happen here is bronchoconstriction. Okay. What effect does an alpha 1 agonist produce at the level of the blood vessels? When you stimulate alpha 1, vasoconstriction of the blood vessels happen, and as a result, hypertension happens, which is increased blood pressure. How about if you block them? The opposite happens. So vasodilation of the blood vessels and decrease in the blood pressure. So which one do you want to use to prescribe to hypertensive patients? Here you want to induce vasodilation to decrease the blood pressures. So patients with hypertension are sometimes prescribed alpha 1 antagonists, alpha 1 blockers.